Okay, and I think we can get started. Everyone, thank you so much for joining us. I'm Sherry Lewan. I am co-president and co-founder of A Better Balance. And we really appreciate your taking the time today to talk about paid sick days advocacy. It still shocks people that there are 33 million workers in our country who lack even a single day of paid sick time to take care of themselves or their family members. And as we make our way through this pandemic, that fact becomes even more shocking. But the good news is that over the last 15 years, we have been able to make enormous progress at the state and local level, passing laws that guarantee paid sick time to 55 million workers across 15 states and dozens of localities, including most of our major cities. So today we'll talk about that progress and what we need to do to ensure that every worker in the United States has access to paid sick time. I'm going to turn the webinar over totally to Dalini Lakachandra, who is a senior staff attorney at A Better Balance. She co-authored our sick time report that talks about the need for paid sick time, the case for paid sick time, and the path ahead. Dalini, take it away.
Awesome. Thank you, Sherry. I am going to share my screen, start this slideshow, and there we go. So thank you, Sherry, for the introduction. Thank you, everyone, for joining. It's great to see so many faces. I direct A Better Balance's Defending Local Democracy project. My name is Dalini Lankachandra, she, her pronouns. And I also have a number of great speakers who will be talking to us all today. We have Crystal Phillips, who's an ABB community advocate. She is graciously sharing her story about the need for paid sick leave and why other workers in similar situations need it. We have Professor Nicholas Seabarth, who is a professor of economics and public policy at Cornell University, and Ida Escamani, who wears many hats in Florida. She is at Organized Florida and leads the Florida Anti-Preemption Coalition. So she's going to give us a little bit of a state perspective on the need for a federal paid sick leave law. And I'm going to start with a quick overview of what exactly paid sick leave is, talk a little bit about the momentum we've been seeing through the states and localities, and then I will speak a bit to why we need paid sick leave, what are the benefits of paid sick leave. So first of all, what is paid sick leave? It provides short-term time off. You can use it in hourly increments and daily increments. It can be used to take time off because of your own medical condition, to attend medical appointments, or to take care of a loved one. And increasingly, paid sick leave laws encompass domestic violence and sexual assault uses. So they allow people to deal with issues that arise from stalking, from domestic violence, from sexual assault. And it's a benefit that's provided by employers. And this is opposed to paid family and medical leave, which is usually used for longer term leave, weeks to months. It is an insurance program that employers and employees pay into. And both of these are really important and badly needed. They serve different purposes. So currently there is a federal unpaid family and medical leave law. It doesn't cover all workers, but as Sherry said, there is no federal right to any paid sick leave. And some people might be wondering why we need paid sick leave now. The answer is that we needed it yesterday. We needed it years ago. There are 33 million workers in the United States who lack even one day of paid sick leave to care for themselves or for their loved ones. And I think that we can all agree that COVID-19 really made it incredibly clear that there is a desperate need for paid sick leave, that paid sick leave benefits society, not just workers. And there's been a long history of paid sick leave in the country, even though there is not yet a federal right to it. The Healthy Families Act was introduced 16 years ago and reintroduced year after year and has yet to pass. There have been some gestures towards a federal right to paid sick leave in the Families First Coronavirus Relief Act. That's the FFCRA. It provided emergency paid sick leave to millions of workers, not all workers, in April 2020, but it expired in December 2020. So that leaves it to states and localities to really lead the way when it comes to paid sick leave, and they really have. And the evidence from all of those state and local laws and from the FFCRA shows that paid sick leave works for workers, it works for businesses, it works for families, and it benefits the economy. And for all of these reasons, especially post-COVID, paid sick leave has incredibly broad voter support. So here you can see the number of states and localities that have enacted paid sick leave so far. There are 14 states in the District of Columbia. There are another 2 states that have passed paid time off laws that encompass paid sick leave purposes. And there are dozens of localities across the country that have enacted paid sick leave laws. And all of these jurisdictions really vary in terms of demographics, in terms of political makeup, but we've seen great success wherever a paid sick leave law has been passed. On the other hand, there are 18 states that prohibit local paid sick leave laws. And Ida will speak a bit more to this later, but these states don't have a paid sick leave law of their own, and they forbid cities from enacting their own paid sick leave laws. So they create this regulatory vacuum where no progress is allowed to happen. And here we can see a timeline of the paid sick leave laws that have been passed across the country, really showing the increased momentum that we've been seeing since in 2006, San Francisco became the first city to enact a paid sick leave law. All of these details, all of these graphics are on our website in the paid sick leave report, Sick Without a Safety Net. And I will drop a link to that at the end of this as well. So in addition to state and local success, or how about this? All of this state and local momentum has demonstrated exactly the ways that paid sick leave benefits workers, their families, and businesses. So first, it benefits workers and their families. It reduces recovery time when workers have an illness. It even reduces recovery time of family members who are able to be taken care of by workers who take time off. It encourages the use of preventative medical care like cancer screenings, yearly physical vaccinations. We're all familiar with those these days. Actually, one of the reasons cited in a recent study for reasons why people haven't been getting the COVID-19 vaccination or boosters is because they don't have paid time off to do it. They're unable to schedule that appointment. It prevents workplace accidents when people are going into work sick and tired, not 100%, they're more likely to harm themselves and others. And the really important part of this is that it reduces short and long-term financial troubles. So the reason that it's so important to have paid sick leave is because we don't want workers to be in a situation where they have to choose between their health and their paycheck. So if a worker is sick, they have to go to work because, or they can't go to work because they're sick, they're going to lose that day's wages, or even they could be fired from their job. So these financial implications are especially important for lower income workers, a worker who's working for $12 an hour. If they take one day off, that's the equivalent of their electricity bill. If they take 3 days off, that's the equivalent of an entire month of groceries. So unpaid time off for many, many workers is simply an impossibility. And as I mentioned, paid sick leave reduces the probability of job loss. Access to paid sick leave reduces that probability by about 25% over the course of 5 months. And it really can not be overstated how impactful the loss of a job can be, especially for a lower income worker. It leads to short-term and long-term financial insecurity. It aggravates chronic illnesses. It reduces lifetime earnings. It creates food insecurity, housing insecurity, et cetera, et cetera. But one of the interesting things about paid sick leave is that, contrary to many myths, many suppositions, it doesn't harm businesses. In fact, it benefits them in many ways. Business owners overwhelmingly support paid sick leave. In cities and states where paid sick leave has passed, in the years after implementation, business owners overwhelmingly support the policy. Despite fears to the contrary, it doesn't result in job loss or job relocation. So if a city enacts a paid sick leave law, businesses don't move to the neighboring city. Instead, they implement this policy, usually with low cost or cost-free measures, like temporarily reassigning work or putting some non-emergency work off until the next day. And another important point to emphasize is that workers simply don't abuse paid sick leave. They save it up for when they really need it, for those emergencies. And another way that paid sick leave benefits businesses is that it reduces employee turnover. It increases employee satisfaction. Worker turnover, like replacing a worker, can cost a business about 21% of a worker's annual labor cost. So it really isn't nothing when we say that paid sick leave increases employee retention. And it increases productivity by decreasing what we call presenteeism, so showing up to work sick, which makes workers less productive, makes their coworkers less productive because they're getting the contagion passed to them. And finally, it allows small businesses to compete on a level playing field with larger ones. Smaller businesses that want to provide robust benefits to their workers, but might not have the financial footing that a larger business has. It allows them to work on the same playing field. And really importantly, paid sick leave protects public health. It is an incredibly effective public health intervention. As we all know, public health agencies always ask workers who are experiencing symptoms of contagious illnesses to stay home. They encourage children to stay home from school when they're sick. But as we've talked about before, this is impossible when doing so would endanger their job or their income. Overall, it reduces the spread of contagious illness. Jurisdictions with paid sick leave see up to a 40% reduction in influenza-like illnesses as compared to jurisdictions without. It allows workers to stay home with their sick children. And as we've seen in COVID, it is workers who have high contact with the public that are less likely to have access to paid sick leave. And this only exacerbates contagious illnesses. So our restaurant workers, our grocery store workers, they're the least likely to have paid sick leave, and they are the most likely to have high levels of public contact. And as we've seen, again, during the COVID pandemic, the FFCRA, the Family First Coronavirus Relief Act, it was a temporary measure, but it helped flatten the curve of COVID-19 infections by 400 cases a day in states that didn't have paid sick leave laws before that. And finally, paid sick leave furthers gender, racial, and social justice. As I've mentioned a few times, it's low-income workers, women, and BIPOC workers, that's Black, Indigenous, and people of color, who are the least likely to have access to paid sick leave. 43% of working mothers, and that's 54% of Latina mothers, and 42% of Black mothers lack access to paid sick leave. And this is especially important because women are disproportionately shouldering the burden of unpaid caregiving, especially Black and Latino workers. And without a uniform paid sick leave policy, Black workers are far more likely to have their requests for paid sick leave denied than white workers. Finally, an inclusive family definition, as in a federal paid sick leave law, will allow all workers, no matter what their families look like, to take time off to care for their loved ones. That means that workers can take time off to care for chosen family, even if they're not related by blood. So all of this is to say is that the time is now, the time was yesterday, but the time is now to enact a robust federal paid sick leave law. COVID has demonstrated that very clearly, that society suffers when we don't have paid sick leave. It has broad bipartisan support and it benefits everyone. And next, I'm going to have a presentation from our community advocate, Crystal Phillips, who can really speak to the personal side of paid sick leave and why it is so necessary.
Hello, everyone. My name is Crystal. I'm from Louisville, Kentucky. In 2020, when COVID first hit, in March, the end of March going into April, I had got sick. The doctor took me out for 2 weeks. I called my job and I told them what happened and that I had to be off for 2 weeks. They stated that I didn't have enough FMLA to be off for 2 weeks and that they wanted to have a meeting when I got from out of quarantine to decide if they were going to keep me on or let me go. Immediately, I went into a panic because, I'm thinking, I'm about to lose my job. I'm going to be homeless, on top of me not feeling well, which was causing, more harm to my health. So I'm panicking. I'm thinking, what should I do? So I hopped on the internet and I started to look for some help. And that's when I came across A Better Balance. I emailed them. I told them my story. And they got back with me less than 24 hours. That's when I met Cameron. I told her my story. She told me she would get back with me and she would see what she could do. She got back with me the following day. She provided me the information from the Family Medical Leave Act and from the Department of Labor, which stated paid sick leave is not a form of FMLA leave, therefore does not count toward the 12-week work weeks in the 12-month period cap. Now, my job, they didn't even tell me that they wasn't offering to pay me, basically. They didn't tell me that I qualified to be paid. And on top of that, they're trying to let me go. So I took the information into the meeting that Cameron provided me with, and I gave it to them. I got to keep my job and I got paid. And when I tell you I was so relieved with the joy, I was thanking God. I just was so happy. Once I got home, I immediately contacted Cameron. She was just as happy as I was. I believe that everyone who's working should be provided with this paid leave sick time off because it's so hard dealing with being sick, or even if you're in the hospital sick, or if you're just being quarantined, worrying about how you're going to pay your bills or just your livelihood, basically. I hope that my story helps someone. And I want to thank A Better Balance again, because I am still grateful for their help till this day. I don't know, without them, if I would even be still working. So again, thank you, A Better Balance.
And Crystal's story, other stories from workers ABB has worked with, all of those can be found in the paid sick leave report. It really is incredible the desperate need there is for this benefit, and how impactful it is on the lives of workers who really do deserve to be treated like human beings. So with that, I'm going to turn it over to Professor Nicholas Siebart, who is going to be talking a little bit about the research he's been doing into paid sick leave.
Exactly. So hello, everybody. Thanks so much for having me. I'm Nicholas. I'm a professor in economics at Cornell University. I've been working on paid sick leave for a long time, since I started my PhD back in Germany in 2006 or 7, I guess. Then I came to the US in 2011, and a lot has happened. So this is a summary basically of my research over the years. It is joined, I should add, with Catherine McLean, Stefan Pischler, Catherine Van, many fantastic co-authors, and we got funding and by several institutions. A Better Balance provided us with a lot of excellent support and help. So let me get started by putting up a quote by Barack Obama. And you can tell it's already 7 years old, when he said in the State of the Union address, "Send me a bill that gives every worker in America the opportunity to earn 7 days of paid sick leave." That is the bill that we have heard in this excellent summary, the Healthy Families Act, that is still not passed at the federal level. Even, and that's another quote, just as an illustration that we could have, in my opinion, in principle, bipartisan support, and we have strong voter support, even among Republicans. And Bill O'Reilly responded the next day to this State of the Union address that he would be supportive of paid sick leave. And so what I want to communicate is that there is hope that maybe in the future we will get a federal bipartisan bill on this. The status quo is, as you all know, the following. Almost all countries of the OECD, industrialized countries, have universal access to paid sick leave. My home country of Germany, we had it since 1886, I believe, as part of health insurance, and all European countries have it, and they consider it like standard worker right. And there's few countries like the United States where you do not have universal access. So in the United States, we traditionally let employers provide it voluntarily, which led to a patchwork situation. We had Ted Kennedy, who hopefully rest in peace, spearheading the Healthy Families Act, first introducing it to Congress in 2005. That's this federal bill that would ensure at least that we have brought relatively universal access to paid sick leave. Never happened, so we haven't gained this bipartisan federal support. And instead, over the last 15 years, as we have seen, many cities and states have passed sick pay mandates, which is great progress, I should say. And a lot of my research, or all of my research, is based on that. You also know 2 years ago, COVID-19 hit. We have then seen the very first bipartisan and federal legislation in the Families First Coronavirus Response Act. It was, not very comprehensive, but it did benefit millions of Americans. And what it did is provide 2 weeks of emergency sick leave due to COVID. Employers could get it refunded through tax credits, and I will give you some evidence of what this law did and some of the summaries that I will show you in the next couple of minutes. So maybe briefly, and this is just a simplifying version of what economists think and how they think about this problem. There's still opponents to paid sick leave, and you may wonder why and how this could be. There are still business associations, I will say, and maybe some conservatives, Republicans also, who are opposed, also Democrats potentially, although again, there's broad support. The main counter argument is that, well, if you provide sick leave, there's what we call moral hazard, and employees would shirk and they get lazy and so on. As we have heard, the way that it is done in the United States, does not give us a lot of evidence that employees really exploit the system or they call in sick when they are not. There's really not much evidence for that. And the second substantive argument that you should take seriously from an economic standpoint is that maybe if you over-regulate, that employment and wages would go down. So we have studied that in a paper. We looked at counties and states that implemented sick pay mandates, and we couldn't find any evidence whatsoever that wages and employment decreased significantly in these labor markets. So we could not find support for that. And the final argument is an ideological argument that I will not further comment. So some people make the case, well, the market would provide it for optimal, which is not the case, I should add. And a lot of people, including many of you, I would assume, have many good reasons, I think, why paid sick leave is a good policy and welfare increasing. I cannot summarize all the additional support that we've found in other studies, like higher likelihood to get vaccinated and so on. But in general, what it does is it reduces inequality and inequity. And you have to know that particularly low income jobs and particularly communities of color and particularly disadvantaged workers do not have access to paid sick leave. And so we have a lot of inequality across jobs and job quality, and that would matter here and increase equity, basically. The last point on this list is reduction in presenteeism. So presenteeism means working sick. And a lot of our work has focused on that because that is a hard argument, especially now, that you can easily make. So the question here is, does access to paid sick leave reduce the spread of infectious diseases? And my mother or grandmother would say, sure, I can tell you, that's clear. You don't have to do research to know that or to show that. Nevertheless, I will walk you through the scientific evidence that we found. So the starting point is that a quarter of all employees in the workforce cannot take paid sick leave. And it's highly unequal distributed. So half the workforce in the low wage sector and service sector, and we know who's working there primarily, disadvantaged people, single mothers or fathers, and we heard the statistics. It's tilted toward a certain demographic group. At the same time, we know that presenteeism, meaning working sick, is a really important channel for the spread of diseases. So COVID aside, and that came on top, but even before COVID, when some of this research was done, we had 500,000 dead people due to flu worldwide. In the United States, depends on the flu wave, but roughly 50,000 a year. And so the flu is spreading, respiratory diseases are spreading, and now we have COVID on top of that. And what has happened, even before COVID, is that several cities and states mandated paid sick leave. So what does that mean? I mean, we saw the map and an explanation, and I should emphasize, and that's very important to remember, medical leave and family leave are important programs, but they are different from these short-term sick leave programs that you can use when you have a cold or common flu and you need to take a day off or 2 days off to go to the doctor or just because you're sick. And the laws are different from the European laws, and they are much less generous, I should add, but also in an economic way, more incentive compatible, meaning that there's less incentive that you exploit the system. And the reason is as follows. So how these laws work is that you have to earn your sick time first. So you work 40 hours a week, let's say, full-time employee, and you get an hour of paid sick leave per week, which means if you do the math, you get 4 hours per month and you get a day per 2 months. And that is your own sick time. So nobody can take it away from you. It is on an individual account. If you don't use it, the days carry over to the next year. And you can typically accrue up to 7 days a year. That's what Barack Obama mentioned. You have some wait period at the beginning when these mandates kick in. You also have the right to take unpaid sick leave, which is really important because many millions of Americans don't even have the right to take unpaid sick leave when they are sick, so they can get fired. And also it's possible to take care of a sick child or family member. So it's a very flexible and personalized sick time program that we have in that case. We've heard that 14 states, DC, dozens of cities mandated paid sick leave in the US, and the Better Balance has really an excellent up-to-date overview, and I used it a lot in my research. So that's a fantastic resource. There are also a couple of states that passed emergency COVID laws at the state level. You can also read up on that. I don't want to be too technical here, but what we do in science is we use what's called difference and differences models to elicit causal effects of these mandates on a couple of outcomes. And one main outcome that we use, and how this works is essentially in simple terms is you take a state that implemented a sick pay mandate, and then you look at the flu rates, for example, before and after the mandates and how they develop, and you compare that to a control group or a control state in that case that has not mandated sick leave, and see how their flu rates do over time. And in this case, our outcome in this first paper that I'd like to show you is doctor-certified influenza-like illnesses. So this is not about COVID, it was before COVID, it comes back every year, and it's defined as a fever and a cough or sore throat. So this is a common cold or could be flu. And in our research, we use data from the CDC, so that's a official data set, influenza report at the weekly level. And we can show, and I will see you that, and this is published research that you can look up. In one graph, you can see what's going on here. So this is a graph that has a timeline on the x-axis that's normalized. So 0 is the time when the state implemented the sick pay mandate. And the solid black line shows you the difference in influenza rates between the states that implemented sick pay mandates and those that did not. And you can see there's a lot of trending around zeros, meaning before the mandates were passed, there was not much difference between states that passed mandates and states that did not. But then in relative terms, you see here, and you can do this at the monthly level to get a little smoother graph, you see a clear decrease after sick pay mandates are introduced in the flu rate in a state. And the first year, that's just the first 12 months, is a decrease of 11%, and it increases over time. So that allows us to test that regions where you have sick pay mandates see lower flu activity, basically. That's what it shows. And on top of that, you can use economic models that show you in a simple way that when you provide employees with paid sick leave options, then you incentivize them to also stay home when you're sick. And this could be when you have a back pain or when you have a contagious disease like the flu or COVID. And that reduces infections. And it's pretty simple. I mean, the logic is very simple. You give people the option to take a paid sick day. And when they are infectious and sick, not all of them, but some of them will take the sick day. And so we published that long before COVID, but then COVID hit 2 years ago. And fortunately, the press picked it up, and the Washington Post said, "Oh, lack of paid sick leave will make coronavirus worse," which is of course true, and we all know that now. But it created momentum for the paid sick leave movement. We've already heard that 2 years ago, in March of 2020, there was a bipartisan support for a law that's called FFCRA that for the first time ever provided 2 weeks of emergency sick leave in smaller companies. And we had another paper that we compared states that where workers gained access to other states. And we found that it prevented 15,000 infections per day. So you could multiply it by 30 to get to the monthly rate. And so there's evidence, not just that paid sick leave prevents the spread of the flu and the cold, but also the spread of COVID, which makes sense and is just intuitively clear. Now the situation is that this law has expired, and workers who don't have access to paid sick leave through their employer have no access at all and are left out there, and they are desperate partly and don't know how to cover their bills and pay their bills, and some of those situations are tragic. We have more evidence on what's happening. So in the middle of the pandemic, we fielded a survey where we asked employees, a representative set of employees, have you heard about paid sick leave and emergency sick leave? Have you used emergency sick leave? And what we found is that 8 million employees used this emergency sick leave, even though it was not comprehensive, but still 8 million used it in the first half year. And then despite this emergency sick leave act, that's the second point, we find that unaddressed sick leave needs, so that's people who needed sick time, but they couldn't take it because they don't have it, tripled during the pandemic. And so right now, 50 million employees per month need paid sick leave, but they cannot take it. And primarily it's women who are affected. So this share is 70% high among women, and that is published research as well. So we have a very high need of paid sick leave. And again, 50 million per month at a time when we had emergency sick leave, which passed now. And let me use the final 2 or 3 minutes to give you some additional evidence from another working paper where we used data by the Bureau of Labor Statistics, and we look at companies, and we try to provide evidence, okay, what's the mechanism? What does it do for employers and at the firm level? So this is from a government survey. And what you see here is, again, a similar graph to before. The 0 is the first year, this is at an annual basis now, is the first year when the state mandated paid sick leave, and -2, -3, -4 is like 2, 3, 4 years before the sick pay mandate. And the line gives you the difference between states that have it and states that don't have it. And what you see here is the effect on actual access to paid sick leave or coverage rates. And what it shows you is when states mandate sick leave, it's effective in actually increasing the share of employees who have access to paid sick leave. So the coverage rate goes up by 18 percentage points in the first 2 years. So the takeaway here is that when you mandate paid sick leave for employers, it is effective in, I'm sorry for that, it is effective in providing access to paid sick leave. And what it does is what you can see here in this graph. So the dark circles give you the coverage rates or how many percent of employees have access to paid sick leave before the mandate. And for example, take the accommodation and food services industry, where we would think that it's particularly important to have access to paid sick leave. The dot tells you that less than 30% had access to paid sick leave before the mandate. And then you move to the right where you see that this diamond, that is the coverage rate after the mandates. It's still far from universal, which is an open research question, why that is, that firms don't provide it, or they don't know it, or they act illegally. But in any case, you see the difference between the 2 dots. That shows you how stark the inequality is, first of all, and that in food preparation and serving occupations, we have shockingly low access to paid sick leave, like way less than 50%. And that when you have a mandate, that it increases and improves the situation and equity. Of course, it also means that employees take sick time. And the question is, how much sick time do they take? And this is the answer to this is by this graph. This shows you again, the line is the difference between states that implemented sick pay mandates and states that did not. And you see here an increase in paid sick hours taken. If you calculate how many sick hours do employees take when they have first access to paid sick leave, you get to a number of 14 hours, so a little bit less than 2 days per year in the first 2 years. And similarly, this is unpaid sick leave, which increases in the short run, but then decreases again, which makes sense because you need to work and earn your sick time before you can take it. So to wrap this up, and then I'm really done, to put all these pieces together, what we find in our research is, imagine you have a population of 1 million people. You have roughly half of them, 500,000 employees. Now, and highly unequally allocated, right? Low-income workers of color and disadvantaged workers have far lower access rates. So now the government mandates that everybody must have access to paid sick leave, and that's effective. So coverage rates increase by 13 percentage points, or roughly you get 65,000 newly covered employees who can take paid sick time now. They take on average 14 hours per year in the first years, so that's 114,000 sick days in that community of 1 million. And you have to imagine these 114,000 people don't go around spreading diseases, and they can take care of themselves and are more productive and healthy later. We find that this reduces the ILI cases that are confirmed, just doctor certified, by 11,000 in that community of 1 million over a course of a year. And that's a decent number, and that improves population health. We find pretty small increases in labor costs, around 21 cents per hour, which explains why we don't see much evidence for significant job or wage losses, sorry. There's not much evidence that it hurts really companies or that it destroys jobs or wages. And then finally, we see that this federal bipartisan emergency sick leave bill, there were some downsides and loopholes, but it was a success in the sense that it prevented 15,000 cases of COVID per day. 8 million people used it in the first 6 months. At the same time, we still know that 50 million employees in the US have needs for sick leave, but cannot take sick leave because they don't have access. Okay, now I really stop. Thanks so much for joining and inviting me. My time is up.
Thank you so much, Nicholas. That was so informative. And I'm going to turn it over to Ida Escamani of Organize Florida to talk a little bit about the perspective from a state advocate and speak a bit to the issue of preemption, a topic near and dear to my heart.
Thank you, Delaney, and thank you, everybody. What a pleasure to be here, and really grateful for the research and data to back up the work and the stories that we've been sharing and doing here on the ground in Florida. We just wrapped up our 2022 legislative session just last week with a slew of preemption bills that we've been fighting. And so I'm now in Orlando, Florida, home of the front line of where the preemption of earned sick time happened here in Florida almost a decade ago. So here in Florida, when it comes to paid sick time, we need national action because there's not a lot of opportunities we can do. There are still a few, which I'll talk about, but national action is so critical to working people here in the state of Florida. And we've had some victories in the sense of raising the minimum wage here in Florida via the ballot. But everything we do, we find ourselves constantly up against a Goliath of a corporate lobby and lawmakers beholden to them. And so it's a constant battle. And so the work that's happening at the national level is so important to the prosperity of Floridians here. And this is very near and dear to my heart. I am the daughter of working class people. My mom worked at Kmart for 15 years. Before then, she worked at McDonald's and Dunkin' Donuts. My dad worked 2 restaurant jobs while earning his degree. My parents are immigrants from Iran. And so when I hear the stories of working people, it's definitely in my blood, in my bones, in my DNA. And this work is so important when it comes to all of us trying to achieve the American dream. And so just very grateful for that work. And so a little bit of history for Florida, and there are folks actually on this webinar that have been a part of this work as well. You know, I was in Orlando, Florida, and I was one of the folks collecting petitions for this local ballot initiative 10 years ago to put earned sick time on the ballot in Orange County, which of course is home to a massive tourism industry. Actually, Disney is not actually in Orange County. It's actually in a different county next door, but very much gets, known in Orlando, and much of our workforce, the Disney workforce, lives in Orange County. And so we had efforts to pass an earned sick time measure here locally. And it was that effort that actually led to corporations like Walt Disney World and Universal and others working in the local level to stop and delay putting this effort on the ballot, but then also working in the state legislature to preempt it. And so more than almost 10 years ago, we actually got this measure on the ballot at the local level. But before the election happened, the legislature came in and preempted earned sick time across the state of Florida. And actually, by that point, the ballots had already been printed. And so this effort did go on the ballot and passed overwhelmingly, but it was a moot point because the legislature had intervened at the bequest of some of the most largest and most powerful corporations in Florida. And these corporations, such as Disney, are still very much dictating the legislative agenda here in the state of Florida. Don't be confused when you see the headlines around "Don't Say Gay" and the governor taking on Disney. When you look at the receipts, Walt Disney World is doing quite fine here in the state of Florida, along with their corporate allies. And so the fight continues. But this is something that our hands have been tied in a lot of ways. There are some opportunities, and I want to really thank the folks at A Better Balance for helping do this work alongside our partners in organized labor, such as 32BJ. Just last year in Miami, we passed paid sick leave for contract workers, such as airport workers and metro rail workers. These are folks who are private employees, but contracted with a local government, right? So there's a window of opportunity there when it comes to providing workers who work in contract with local governments these really critical protections. We also at the state level have put forth time and time again legislation to repeal the preemption that currently exists. And these bills don't move because I'm sure folks can relate in your legislatures, the ruling party decides the agenda. And unfortunately, this is not something yet that is a priority of that party, but we continue to put it forward. And during the pandemic, our repealer legislation earned a lot of headlines. A lot of folks, to the point that was made earlier, we're shocked that we don't have this local power, right? We don't have the freedom to pass these protections. And so being able to pivot and anchor these proactive pieces of legislation that are designed to put that power back in the hands of the people was really critical throughout the last year to really highlight this issue that we have in Florida, because everyone generally agrees that workers should have these opportunities and these basic protections. And so to be able to point to a bill that has continued to just sit stagnant because legislative leadership do not want to hear it has been very important as we try to tell this story, right? And really put the argument together why we need these policies. So the windows of opportunity when it comes to local government and contract workers is certainly important. And not surprisingly, our opponents know this too. So just this last session, we fought off and beat legislation that would erase every responsible wage ordinance in Florida with public contractors, right? So we're still able, when it comes to local government, to raise the minimum wage for local workers, for folks who are employed directly by local government and also contract, right? And so what this bill did this last session was try to essentially prohibit the ability of governments to have contract workers be paid a higher wage than the minimum wage. And this would impact airport workers, seaport workers, metro rail workers, really blue collar working class folks. And they would see an automatic pay cut from maybe making 15 or 17 bucks an hour to 10 bucks an hour here in Florida if this bill became law. And I share it just to share that this window of opportunity around contract employees is one that our opponents are going after now as well. So it's kind of a new front line for us in that. And to also share that we defeated it, and we're proud of that, and we're going to continue to do that. And it's interesting because the argument they made in support of their policy was a free market argument. They said, well, we have a labor shortage right now. And even with preempting these wages, workers will get paid more because of the labor shortage and the market will demand it. And so wages will go up, right? And of course, we know this is utterly false because we'd be in a very different place in the state of Florida. We wouldn't have to go to the ballot to raise the minimum wage if that was the case, right? There's no stopping corporate greed in the state of Florida or in this nation. So, but it's interesting. Those are some of these same arguments they were making in support of this proposal. So going back to, our fight for paid sick time, right? Again, we are up against a Goliath of a corporate lobby in the state, groups like the Florida Chamber of Commerce, Associated Industries of Florida, the Retail Federation, the Hotel and Lodging Association, the Restaurant Association. These are all the trade groups that represent these brands that we all know well, right? That we all, know in our communities that are constantly working to undermine basic health and equity standards for workers. And so we are very grateful for the work happening. I can tell you, as someone who works in a state legislature, that can be a very tough place. We're very grateful for the amazing work happening at the federal level. Preemption is a neutral tool. It can be used for good and for evil. And so the work here at the national level, I would say, is a very, very good preemption of setting basic health and equity standards for working people in our state, in this country. It's a popular policy. It's one that will really liberate folks to, of course, have those basic protections, but also be more engaged in the political process, because we know once folks have these basic needs met, the opportunities are endless. So we're very, very grateful for y'all's work, and more than happy to talk more about the struggles in the Florida state legislature. And also, I have to say, I'm very sorry, the governor that preempted earned sick time in Florida, Governor Rick Scott, is now a U.S. Senator. So unfortunately, he is wreaking havoc on all y'all. But we are grateful for your work. And we wholeheartedly stand in solidarity around these national efforts to protect workers.
Thank you so much, Ida. This might be the first webinar I've organized that's running right on time. So we have exactly 10 minutes for questions. I'm gonna go ahead and share my screen again and put our email addresses up there. Can folks see it? Cool. So we have a link to the Sick Without a Safety Net report, to a Better Balances paid leave website, and I have email addresses for all of the speakers today. Please feel free to reach out to me if you have any questions. I love hearing from people and answering them. And Jared, have we had anything come in the chat? You might be on mute if you're trying to answer.
Yeah, hey everybody, this is Jared from A Better Balance. So one question that we have for today's speakers is, Sherry, if you could just speak briefly about what's been happening federally, both recently and as we think about the Healthy Families Act going forward, any other information about what to expect?
Yeah, I mean, I don't want to leave anybody with the impression that this is going to happen anytime soon at the federal level, that we're going to pass the Healthy Families Act. We've been trying very hard, working very hard to try to get paid sick time into the COVID relief packages. There's been some back and forth on that. We did get it into the vaccine mandate that happened a few months ago, but of course was struck down by the courts. So I think the good news on that is that there's so much more conversation about sick leave at the federal level, both in the administration and also in Congress. And we do have some congressional advocates who really are very interested in trying to push this forward. So I think it's going to be a long process, but I think, as you've heard today from everyone that spoke, it's so important for workers, and it's particularly important for workers who are in states like Florida, where it's going to be really hard to pass a statewide law to have some kind of a national baseline. And the Healthy Families Act has been a minute. I mean, we've changed it over the many years that it's been introduced. It's a strong law, and we are ready to really try to push it at the federal level. So people should be aware of that. People should talk to their, congressional representatives and make sure that there is some knowledge that, this is important to their constituents.
Thanks, Sherry. And then we also have a question for you, Nicholas, about if you could speak for another moment or two about some of the recent research about how workers really only tend to use a couple of sick days when they're newly covered by a sick time law, and if there are any implications for how advocates can think about that research in terms of the cost arguments that we often hear from opponents. That would be great.
Yeah, that's a great question. So my advice is to walk people who make this general argument, workers exploit this and they become lazy, to walk them through the specifics of what it means, and that you have to work. Actually, you get 1 hour per 40 hours that you work. And even if you assume away all like benefits, that you're happy, you're more productive, you can take care, inequality, all these arguments, this is not a very generous provision, right? You get 1 hour per 40 hours of work. So in a static world, this is 2.5% of your salary, basically. And you have to work and earn it. So it's no wonder when you have no access to paid sick time and now you have it for the first time, after 2 months of full-time work, you only have a day, right? And then it accumulates up to 6-7 days, which means in the first years, at least, workers will not take many sick days. And 1 or 2 sick days on average, it's not a lot, and it does not hurt businesses at all. I mean, if anything, it improves the worker morale, productivity, and reduces infection rates. Also to customers, by the way, because no customer wants to go to a restaurant or hotel and sees sick workers around. So for employers who don't really provide it, maybe there's room to convince them. And the final comment about, if you think about this as an individual credit that does not expire and accumulates and rolls over, there's no reason to believe that workers would A, take a lot of sick time, and B, that they have a lot, and that C, that they would misuse it somehow or waste it. That's just not the case, almost by construction, because you never know when an next flu hits and you have to take a week off, maybe even or COVID or your child, or so there's simply by construction not much room for exploiting the system, I would argue. And all the research has not shown that it's devastating to businesses or super costly. That's just not true, and it's just not the case. Which is also plausible when you walk, again, people through this example of individual credit. It's not like Germany, just as a counter argument, Germany, you can take 6 weeks, up to 6 weeks, 100% sick, 100% wage, and there's basically no limit. And still the German economy is also doing well, but probably you have a little bit more of the workers calling in sick when they are not necessarily sick, not in the United States. I mean, that's pretty clear to me.
Great, those are such important points. So yeah, thanks so much, and shows why the research you're doing is just so helpful to the field. So we have another question, which I'm actually happy to speak to, since I've been doing some work in this area, about how we're thinking about leave policies for workers who are considered independent contractors, whether gig workers or those who are independent providers, home care workers, for example. And this is a really important issue, and one that a better balance and many of our partners are thinking about, the future of work and what it looks like, and would be happy to connect with anybody who's interested in thinking this through. But, a couple just quick points is that paid sick leave is structured as an employer provided benefit, but it's also very important that, and we're always aware of this as we're drafting, and our model bill has language that is really clear, since so many workers are misclassified as independent contractors, that first, there's ways that we can draft this to address how rampant misclassification can be. And then also just a lot of thinking and planning about how to provide more portable benefits to workers who are in the gig economy, who are truly independent contractors. And there's some interesting work at the local level that we'd be happy to speak more with anybody who's interested after the webinar. But that's a great question. And I think we have one more question as well, maybe, and based on Ida, what you shared about the really exciting development in Miami-Dade County and contractor sick leave, and how contractor sick leave and also sick leave for government employees could still be an avenue in places that have a limited political path or preemption. So the question, and Delaney, maybe you could speak to this, is whether that could be an avenue in other states outside of Florida.
Yeah, absolutely. And Delaney, I definitely would love for you to take some time on it too, but it's absolutely an opportunity. And it's also a place we need to protect, because we're seeing our opponents encroach on this, which falls into a whole area of contract law and all these other pieces, right? But nonetheless, they're pretty relentless in trying to strip away these protections. So it's absolutely an opportunity, and also a place that we need to protect. And really grateful for your amazing work and the folks at ABB for writing these policies and working with us in partnership.
Ida, you're gonna make us blush. Yeah, it is a very important avenue for expanding the reach of paid sick leave when there's state interference, or when there isn't a path towards a state paid sick leave law. And as Ida mentioned, we're seeing more and more states trying to cap the abilities of localities from having these contractor standards, engaging in this kind of living wage or paid sick leave work for contractors. So given that ABB works with folks across the country, you have my email address there. We're very happy to help if folks have any specific questions, and to kind of brainstorm and talk through what your state or locality is able to do. And that brings us to time. Really quickly, we will distribute a recording of this webinar. We'll distribute the slides. I really appreciate everyone who has joined us. And thank you so much to our presenters. Thank you, Professor Siebart. Thank you, Ida. Thank you, Sherry.
Thank you, Crystal. Thanks, everybody, for joining.
And thanks,
so
Crystal.
yeah.
Oh my gosh. Yeah. All right. Bye, everybody. Have a great afternoon.
Thank you. Thanks for organizing.
Thanks again, Nicholas.